Hey everyone, I'm Lajos Kemény, the editor-in-chief of the International Journal of Dermatology, and our guest today is Dr. Ellie Choi, who is the section editor for clinical cases. So she is a dermatologist from Singapore, a consultant at the National University of Hospital Singapore, and assistant professor at the National University of Singapore. Her clinical and research interests are psychodermatology, behavior, and health services research. So, welcome, Ali. We can start our discussion with my question is that you are one of the most important section editors in the journal. You are receiving a lot of cases and case reports, and you are doing really a brilliant job. You are quick and fast, and you review the papers and assign the papers very rapidly. Could you please share a few words about your motivation? Why did you join to the IJD editorial board as a section editor for clinical cases?
Great. Thanks, Lajos, again for inviting me, and I'm really honored by all the kind things that you've said. So I think when I was invited to become like a deputy editor, I was at the time an editorial board member, and I'd been reviewing for IJD for a couple of years then, and also publishing quite actively in IJD. It really is one of my favorite journals, and apart from myself, a lot of Singaporean dermatologists like to publish in IJD as well. So I felt like I was quite familiar with the journal already. What was its scope, its kind of selectivity, and the way the editorial process goes. So when this opportunity came, I just jumped on it. I thought it's a great way to be able to contribute to the journal in a new way. At the same time, opportunity for me to expand my knowledge and experience. And it's been a great journey. So,
yeah, excellent. And what do you think? What is the most challenging task in this position?
I would say I think, and probably most of the editors will agree, that it's finding good reviewers. Good reviewers in terms of putting in like good quality reviews and also in a timely way. I think for anyone who's back end, we are familiar with the process that you invite reviewers and quite a lot of them do not respond to the review invitation. And then you need to invite even more reviewers and that adds delay. Also, there are people who agree to review but do not put in a review, or they put in a review that's really short, something like one line, like it's a great paper, suggest it be accepted, or it's a lousy paper. And all these are not very helpful to the authors. And then it can be difficult because then you have to think about inviting new reviewers. Or what I usually do is I always read through the article myself and make sure that it's suitable. Apart from reviewers, I think another challenge, this is for me, that when I'm looking through an article, and I always look through it, to be conscious of my own biases and my own emotions towards a paper that may not be objective. For example, if I see authors that maybe I particularly respect or not such a big fan of, then that can immediately cloud my emotions. And I think that's something for us to be, for me at least, to be conscious about, especially when we decide whether, for example, whether we want to be a desk rejection because you feel like the idea is a novel, or if you have reviews that come back that are conflicting, one is accept and one is reject, then it comes to your opinion on what you should do about it. So I think those are my main challenges.
Yeah. We have to face all the difficult problems. And as section editors, I know that you are working a lot, and finding reviewers is probably the most difficult issue. And as you mentioned, sometimes the reviewers accept the invitation, but they do not deliver. This is probably the worst situation, because it will result in a huge delay in the manuscript. As an author, we are all authors as well. As authors, we want a rapid decision and rapid review. On the other hand, when we got invitations from many different journals to review a paper, then many authors are reluctant, and they say, "Oh, I don't have enough time." On the other hand, when the same author is asking what is the situation with my paper, they suppose that somebody should do the job. But this is a difficult situation. I know that the section editors has a lot of duties and most very difficult issues. And this is the reason why I introduced a new position in the journal, the so-called junior editor position, to help the editors. What is your feeling? Was it really helpful? And how, I know that you have also a junior editor, and how can you work together? And what is your opinion on that?
Yeah. So I'm not sure if you remember, Lajos, when you first rolled out this junior editor program and Anita asked me, I actually said like, oh no, I don't need a junior editor. I'm actually very fine on
I remember that.
2 months later, I thought it would actually be nice having a junior editor. At that time, I felt it was more an opportunity for the junior to learn rather than myself requiring help, because I log into the portal like twice a week. So I think it's relatively easy for me to keep up. But I tell you, once Wei Tiang became my junior editor, things became so much easier that now I'm glad that I actually took up the offer. It's about, sort of sharing the workload. And my junior editor, Wei Tiang, he logs into the portal as well about twice a week. And he keeps me updated and keeps me accountable. So when he's put in like a pending decision, he would always send it to me and say, can you take a look at this? And then I'll be reminded to look at it. And I do always log into the portal myself once or twice a week. So if he has forgotten to, or if he's very busy, then that's also me being able to catch it. And I think it always is helpful having the additional pair of eyes on the manuscript, because sometimes the comments that he writes in, even though he's just a dermatology resident, they are very insightful, and they are things that I didn't notice when I read the article myself. So it's also very humbling for me to be able to learn from my junior. And I mean, he's not here, but I do believe he's learning a lot from this as well. And it's a great experience for him.
Yeah, I'm sure that they learn a lot, and not only how the editorial system works, but also dermatology. We do have also junior editors, and they are reviewing all the papers, although they are only derm residents. We were talking about this issue before, whether a derm resident can review papers or not at all. But I think so that they learn a lot. And of course, not big reviews are handled by the junior editors, but small case reports with 600 words length. It is something that a junior editor can really do. And with this, they can also learn dermatology. Because they have to look around a little bit what is known on this topic. And I think that it is really useful, not just for us and for the junior editors, but in their later academic career. And I hope that there will be also a network, not only in between the editors, but also in between the junior editors. When they attend meetings, they can meet with each other. And this network, networking is always important, and to discuss about diseases and how do you treat the disease, because we are international journal, and international society is the owner of the journal. And there are so many different ways how to treat a disease, and we have to we see that in different parts of the world the same disease is treated somewhat differently, and the healthcare system is also different how to manage the patient. So it is always good to have other views about the diseases and about dermatology in general. What do you think?
I completely agree with you about the benefits of being able to network. I think sometimes people, when they say the word networking, it may come across as negative, like you're trying to gain connections to put you ahead of life and to be able to make friends in the right places. But I don't think that is so. I think networking is about making friends and, like you said, understanding how things work. And it's really a process of learning to become a better person yourself. It's not like you network to get ahead of other people, which I think sometimes people have that wrong perception when it comes to networking. But I feel like just meeting so many people from around the world and getting to visit your university in Saget, that was really eye-opening for me. So really enjoyed that.
Yeah. Thank you. What do you think? What were the major breakthrough in dermatology in the last few years? And maybe you can also talk about your special interest about your research.
Okay. I guess breakthroughs first. I'm not sure it's really a breakthrough, but I've been seeing a lot of articles come through that are based on big databases. So, for example, the China X database, and I've seen a lot of studies coming from the All of Us database. And I think it's very nice and it's really commendable that people have spent all this effort consolidating the data of many patients and actually making it publicly available for researchers all across the world to analyze. I think that's very nice. And hopefully in the future, we would have even more of these stronger databases and things that even include like biobanks, like genetic data. And then hopefully that will build us through to having more personalized medicine and better treatments. In my particular area of research, I'm quite heartened to see that people are more accepting of qualitative research and behavioral and health services research, both inside and outside of dermatology. I remember when I first tried to publish my first qualitative paper, that was maybe like 8 to 10 years ago. I submitted to a top tier journal and they just came back saying that we couldn't find suitable reviewers for a qualitative study because none of them have the expertise. But now, every journal publishes qualitative papers. So that's quite nice for me. Yeah.
Mm-hmm. And I know that you published also a paper about the nail changes in Pemphigus. Could you a little bit talk about this topic, a little bit more detailed?
I think the idea for this topic came across because we were seeing some patients with nail changes and we weren't sure whether it was related to pemphigus or otherwise. So we actually did a systematic review of nail changes where we put together case series, case studies, and actually found that nail changes in pemphigus are actually quite common.
Yeah. What do you think, what are the major challenges in patients' care in general or in medicine in general?
I would say in patients' care, the problem is always matching the doctors to where the patient demand is. So we always kind of feel everywhere, and maybe it's true that there are not enough doctors to run necessary services. There's always a shortage of doctors in critical areas. For example, for some people, it's primary care. And in dermatology, there is often a shortage as well, especially in the public sectors.
Yeah.
But that could also really be because there is a uneven distribution.
Mm-hmm.
Unfortunately, I think it's in every healthcare system, Singapore, USA, Hungary, maybe even, that the private sector always earns more money, and that tends to be focused on the more elective kind of cases, whereas in the public sector, the pay tends to be lower. And therefore, naturally and understandably, people veer towards areas that bring them higher utility, but that can lead to shortages in areas that are quite critical. So I think that's number one. Number two, and something that speaks very much to my personal heart, is that as doctors, the more patients we see and the more busy our clinics is, the easier it is to become very impatient, unempathetic to the patient. And actually, that was the basis of one of my current research, which is that there's a tendency for doctors to consider the patient's severity as lower than how the patient actually thinks their condition is. So doctors tend to underestimate disease severity relative to the patient. And of course, you can imagine the problems it creates. So patients will feel that the doctor is unempathetic to their concerns, are downplaying their symptoms. Whereas for us doctors, we may think that the patient is just very, like, making a mountain out of a molehill, or being very anxious. And when we see so many patients, especially if we're in the public sector, and some patients have really bad rashes, it's very easy to forget that to a patient, even a new patch of rash or something like a BCC on your face can be very scary to them. But to us, it's unfortunately has just become such a normal part of life. So that's a personal challenge for me.
Yeah, I think that all over the world we see the same trend that in the public sector, less and less dermatologists are dealing with real medical problems. And many dermatologists are moving to the private sector. And sometimes focusing on aesthetic medicine and less to medical dermatology. How is in Singapore, when you are working in a public sector, are you allowed to have your private one as well? So are doing both, or how is working in Singapore?
And that's an interesting question. I know for some countries like USA, you can have your own private practice and simultaneously be in a public hospital. Unfortunately, Singapore, by and large, that is not allowed. If you're primarily employed by a public hospital, you cannot run your separate private practice. Although we can see private paying patients in the same hospital, but we do not, for example, get a cut of the clinic visit. So we essentially don't earn extra for seeing private patients. But yeah, so that's the case for us. So if you go into private, you are usually just fully private. But there are benefits of being a public hospital, I must say. For example, you have some protected time to do research. You can apply for grant funding. You can have time for education. Whereas if you're in private, it really is largely fully clinical.
Yeah. So returning back to the journal, we are talking always about the quality of the journal, and as a measure factor, how to measure the quality of the journal is the impact factor. And everybody is talking about the impact factor, and in our journal, especially in a situation when we want to publish papers from different parts of the world, from Africa, from underdeveloped countries, about rare diseases, or not really rare diseases, but about those disorders that are not really treated by Western countries, such as leprosy or different tropical diseases. These papers will not be cited many times. So this is definitely not good for the impact factor. So what is your feeling about the publication industry in general, and about how to measure the quality of the science?
Yeah, that's a great question and probably very complex. I think the impact factor, which is a very simple metric based on number of citations over number of citable articles, is probably too simplistic to capture the spectrum of what defines a quality journal. And I think we've all seen how different journals can play around to increase their impact factor, sometimes very artificially, which in no way represents higher quality. You're just playing around with the metrics to increase the impact factor. And I think that is sad. So I think as an industry, we have to move towards a new way of measuring journal quality. Like, for example, the readership, the impact of the article, the representativeness, like you said, whether it's looking at also there's neglected diseases or diseases that are important, even though they may not be citable so much. Sometimes articles that are highly citable may simply be, for example, reviews, I guess guidelines as well, but they may not necessarily be the most important articles out there. So I think we need to move towards looking at other metrics of quality.
Yeah, of course, if you are publishing papers on hot topics, then these will be probably, these will receive higher citations, and then therefore these would be good for the impact factor. But we must not forget other areas, such as you are reviewing a lot of case reports, and we know all that case reports are not so frequently cited, although very useful for learning purposes. So this is something that we have to play around, and I think that we have to keep this kind of papers further on, because we, as dermatologists, we can learn a lot from these case reports. What would you suggest for young dermatologists? How to be involved in research and writing and reviewing papers?
Well, I think my main strategy is find someone who can mentor you and just get started. So how I got started was because a doctor who's not a dermatologist, she gave a 1-hour lecture on how to review an article. And then after that, I got a chance to review an article that was assigned to her, like a tag along. And after that, I just somehow had enough confidence that when I got my first invitation to review, because when you publish and then your name comes as corresponding author, you naturally may get flagged up as a reviewer next time. I just took the opportunity, and one led to another, and next thing I knew, I was reviewing like an article every week, and then it became 2 articles a week, and then 3 articles a week. So
never ending.
my advice is you just have to get your name out there first, and then just do it. Don't be afraid. Yeah,
but you mentioned to find a good mentor. That is critical. How to find a good mentor? How can you find a good mentor? This is not easy. If you would be a young dermatologist, then okay, find a good mentor. But you are working in a hospital. How to find the best mentor for you?
I guess that's why I think IJD is great, because it has opportunities for people to become junior editors. I know there are a number of journals apart from IJD that actually have all these mentorship opportunities that these young doctors can just Google and search for, and then they can be enrolled into such a program. I'm not sure, Lajos, maybe you know, but I actually see under some softwares, when I search for reviewers, there's actually this list of people who have expressed interest in reviewing for your journal.
Yeah.
And then I often do click that, and then it comes out a list, and I select from that. I'm not sure if you know how people can get onto that list.
Yeah, it was, I think it is through the LiQWYD or maybe Web of Science. I don't remember. No, it is Wiley. It's one of the Wiley websites, I think.
Yeah, because I also do remember that, as an author, when you submit an article, there sometimes the question that comes out saying, would you be interested in reviewing for this journal? And I always click yes. So if you're interested, you should always click yes.
Yeah. Yeah, good, Ellie. Then thank you very much for joining to us and for being with us today and sharing your insights about dermatology and about the journal in general. And see you soon somewhere in the world in one of the meetings, maybe in Paris at the EIDV meeting.
Maybe. Thanks, Lajos. Bye-bye.
Thank you, Ellie. Bye-bye.